Are you ready to share your medical surgical expertise?
Do you have an exciting research project or innovative solution you want to share with your peers?
Now is your time to shine. Submit an abstract to present at the 2025 AMSN Convention in Austin, Texas, September 11th through the 13th.
Whether you have valuable insights, innovative practices, or compelling case studies, we want to hear from you.
To be considered, submit your abstract by Friday, January 10th.
To learn more, visit www.amsn.org. On this episode of Med-Surg Moments,
How to deal with acute care emergencies.
He stopped talking and immediately the color washed out of his face and he went into like a full-on seizure. I tell people that it looked like a cartoon. His face just went from like colored to like white. Got my friends in there. We actually started doing compressions because he was not breathing. Then he started waking up and I looked at my nurse friend and I said, "What do I do?"
this is Eric,
Maritess.
Sydney.
Sam?
Neil,
And Laura. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to deal with acute care medical emergencies. But before we get started, how about some personal updates? Laura, why don't you start?
Sure. Hi, Maritess. I am doing great. Life is good. Life is good. I just celebrated my 12th wedding anniversary. Go me. Yay.
Happy anniversary!
Thank you. Thank you. And at work, things are moving along, just trying to close out 2024 and get ready for 2025. We are working on some things based on our recent Joint Commission survey. So not too bad, nothing too serious, nothing that we couldn't handle. But we are so glad that that visit is over and we can breathe for a little while.
I'm with you. I had 2 hospitals in Joint Commission, and yes, there's nothing we cannot handle.
Good vibes to both of you for your Joint Commission visits. I know that can be a high stress time, especially at the end of the year. That seems mean. We always have ours in like March. Spring cleaning kind of is how I like to think of it. For me at work, again, just kind of gearing up for 2025. I'm kind of leading my team in our big course revision process for the year. So reviewing everything, updating contact hours, making sure everything is still addressing the gaps that we're seeing in the nurses, making sure that we're getting them as prepared as we can for caring for patients out there. So that's kind of a big chunk of work that I have been doing, gearing up for the big holiday season. I think having a kid now, I just want to do everything so that the holidays are just as magical for him as they have been for me my whole life. So having that new lens has just been so much fun, and starting new traditions and all these things. So really looking forward to all this family time that we get to spend. So yeah, that's it for me. Neil, how have you been?
Things have been going well. Really enjoying my high point job. And happy anniversary, Laura. Sam, I don't know if I've mentioned this in past episodes. It's my parenting hack. My baby, my little girl is 21 years old, so she's not my baby anymore. I don't know if I've mentioned, my daughter is studying abroad in Korea for this whole semester, which is, I know we always talk all these things and stuff. I tend to forget if I mentioned that. I was so lucky because she actually goes to Appalachian State up in Boone, which since Helen came through there, luckily she was over in Korea. You know, Korea is still having their little conflicts between North and South always. But I was just so glad she wasn't up there. I didn't really have to worry about her. Random side note too, she just got accepted to an accelerated master's program up there for business administration. After I get finished with my second master's, I told her she has to go for the PhD. But Sam, a parent hack, open your child a Gmail account with their name and save all the memory on your phone, and any pictures you take, just send them right to that Gmail so you don't have to waste phone storage. And then at 18, give them the password and they have their photo album to their life. But I tell you, High Point's been great to me, and I've been enjoying the perks of working there. I get to go to their basketball games for free. Since the winter season's upon us, they have a giant drive-through display of nutcrackers. it's my holiday season. I'm working all the winter holidays. The way my hospital system does it, they kind of break it up into like quarters every 4 months. So like I'm working the winter holidays, but I won't work any of the summer holidays or anything like that during the springtime either. So it's kind of nice sometimes. I don't mind working it. And usually I try to trade with people if they have kids. Everybody has their different time. And the very exciting news, since I officially graduated, my graduation from UNC Wilmington is in the middle of December. So I'm having a beach graduation celebration for myself. I'm going to go walk and get my master's hood, which is so exciting.
That's awesome, Neil. Congrats.
That's awesome.
Yes, thank you. And I'm going to give myself for the holidays a beach vacation. I'm a northerner by nature, so going to the beach in North Carolina in the wintertime, maybe I'll do a polar bear swim for myself again or something fun like that. But I know I've shared on the podcast before, I'm a cancer survivor. When I got sick, my dad had just started working on his master's in nursing. My dad never got to finish his because I got sick. I know it was so hard towards the end of my program lately, between my brother passing away in the middle of that and everything. And by the grace of God and hard work and hustle and the support of friends and loved ones, I got through it. And I just want to take that moment to kind of reflect and give back to Dad. I always looked at my dad's lamp as something important. I don't know what happened to it once I moved out of the house. And he got buried with his nursing pin. So I'm very excited and actually very humbled to close that book for third generation nurse, to finally have a master's prepared nurse in the family. Sydney, why don't you give us an update on your life?
Not much going on over here. Just still getting settled into the new job. Really excited for the holidays this year. It's my first one back stateside for 2 years. And my first one being a clinic nurse, I get all the holidays off. So first holiday season in the 5 years that I've been a nurse where I have all 3 end of year holidays off. So I'm excited to spend it with friends and family. We've got a couple Friendsgivings coming up. So yeah, just really looking forward to this season. Maritess, what's going on with you?
I agree. Holiday season. I look forward to that, really. It's just that I'm not ready. Can I share with you as early as today, because my husband's off today, he had a Christmas tree out, getting ready, because we have a tradition on Thanksgiving. We put our Christmas trees, all the Christmas decors. I'm not ready yet. I'm not really ready. We have our Christmas list. We do all our secret Santas and all those extra traditions, because it's true, to Sam's point, you have to create all those fun, loving memories with your family, and they will remember all of it. Just like what Neil said, like all those parenting hacks. And Laura probably have the same. Tradition is everything when it comes to family. And that's what I remember when I was young. And so I'm passing that on to my kids. And so even though I'm not ready, I told them, I'm like, why is the Christmas tree here? Like, not yet. But you have to really go through it and do it with the family. It's a fun time.
It is. I will share, and Sam, this might be something you can think about. I don't know if you already do this, but we used to put my kids in front of the tree. We would take the exact same picture every single year. So I can go back now and see the progression of how they grow.
That's
and it just makes me smile.
Yes.
Yes.
Love it.
We actually make our own ornaments same year. Like we put our pictures, and then we have all the ornaments of the past years and then the current year. During COVID time, I think we skipped the picture because it was sad. We were all wearing our pajamas. And so we kept that, and we actually blow it up. And instead of like putting it in the tree, we have it in our living room to remember that we never went out during COVID. It was just there. But it's the tradition, and just looking back. But that's what's going on personally. Professionally, I shared with Laura, the Joint Commission. We got this, but we are in the open window now because they came, and so they're coming back for the next 2 weeks. Whew. It's okay. We got this. I don't know when they're coming, but we are ready. Excellence is a habit. That's what we always tell our teams. If you're always doing it over and over, it's okay. We're doing our best. Another that I wanted to share is that finally, I think I shared in the previous podcast that I'm really trying my best to put together a chapter, an AMSN chapter in West Palm Beach area. And so we are having our first virtual meet and greet. it's not official yet that we're applying for it. Like I said, the application is there in my account. We need to form a team. We need to form leaders. And so we have that first meeting, and I have 2 Med-Surg directors already interested to bring their teams together. So I'm really looking forward to have an official, we don't know how to call it yet, but it's in the Palm Beach area here in South Florida. So for the listeners out there, if you're interested, email AMSN. I'll reach out to you. I don't know yet how the communication would go, but for sure it will be in social media for sure. So really looking forward to that. It will happen. We will make it happen for sure.
I'm sure you will, Maritess.
Why don't we move on to our topic, how to deal with acute care emergencies? Who has some stories and lessons to share?
My first piece of advice is, as soon as I say don't panic, everybody's going to panic, but really try not to panic. When you're scared, you will know what to do. Hit that button, call out to your team, and I guarantee you the help will come. Just start doing what you know to do. You know how to do BLS. If you need to do BLS, start doing BLS. If you need to get somebody on the phone, get them on the phone, but try not to panic.
Yeah, I think another piece that goes along with that is having a very clear understanding of how to escalate concerns. So you kind of like your chain of command, whatever that might look like. So it might be from you to your charge nurse, up to rapid response team, providers, hospital supervisor, whoever that might be. But I think as soon as you get kind of an inkling that there's something going wrong with your patient, telling somebody and getting another set of eyes in there, even while you're waiting, there's so much data you can collect. Vital signs, blood sugar, talking to the patient, finding out, are they feeling different? What kind of things have they been experiencing since the last time you saw them? What happened with this change? And having all of that information will be really valuable for everybody else who's going to come help you try to take care of that patient and get them the care that they need.
And stay in the room. You have the most valuable information that team is going to need. So I know it might be scary, especially if you're a new nurse, but stay in the room.
And especially for new nurses, this might be self-explanatory, but being familiar with your equipment, where it is, and how to use it. There's nothing worse when you think you need a blood sugar, the EKG, and you're like, where is it? Or trying to put leads on and they're all tangled, or can't find the on button or the print button. Just being familiar, especially if you float, just taking a quick lap and finding out where all that equipment is. Because like I said, there's nothing worse than needing equipment and you can't find it or you don't know how to use it.
I want to tag along with that, the protocols, because aside from the equipment, finding out or making sure that you know what your protocols are, because that would really help.
If the patient sees you panic, that's just going to double down. That's just going to make it so much more disastrous. And I think that's a very good point, is being familiar with your surroundings, your machines, your devices that are in the room and how to use them. I openly admit a lot of these rooms that have all the EKG or the telemetry in the room and stuff, and you get cycle blood pressures. Like, I always struggle with how to program that because I don't program it that often, but you do want to do that when someone's just kind of not feeling right. I have no shame in asking a tech to help.
I want to really ask this question. I think the reason why also what I thought of this topic is because, have you noticed like some Med-Surg nurses are afraid to call a rapid response? I noticed that rounding in the units, they're afraid. And I asked one of the nurses, you can't call a rapid. And they said they feel like they don't want to be punished for calling a rapid response. And I said, you have to empower yourself. You need to really speak up, even though you have all these tools and all these equipment. But then you yourself, you're not empowered to call that emergency yourself. You're going to fail. If you're worried, you're concerned of something, you can't really figure it out. That's why you have a rapid response team. So call that rapid response. It's okay.
Yeah, it sounds like kind of some unfortunate cultural issues maybe and some interpersonal stuff between those two teams. So you just have to think about the patient. What do I need to do to care for them, keep them safe? Sometimes that just means having uncomfortable conversations or interactions with people, even if you're a little bit worried. But that's a time where you really can't delay if there's an emergency going on.
Yeah, and I always feel like you're better to call it than to not call it. Really, like, I've never gotten in trouble for calling it and not needing it, but usually my intuition's right. But it's funny you say that. I had a nurse I worked with, Rick. I'll call him Rapid Rick because like if he just didn't like the something, he was just like, I'm calling it Rapid. I was like, hey, good on you. You know, you're being a patient advocate in a way. I've never seen as calling it a code or anything like that as a bad thing. If something's just not looking right, better safe than sorry.
One of the most memorable rapid responses that we called, I had a patient who had been admitted for a stroke was his diagnosis, and he had had one very recently, like within the last month or so, and he had come from a skilled nursing facility, and I was going about my morning, and he was the last patient I was assessing, and in the back of my head, I thought, like, I'm going to call that facility after I'd done assessing him and find out, like, what were his symptoms that made them think he had another stroke. And so I'm assessing him, we're chatting, and if you're familiar with the NIH stroke scale, there's this cute little picture of a kid reaching into a cookie jar and the water's spilling over the counter, and you're asking the patient, like, can you tell me what's going on in this photo? And I'm like holding it in front of him, and he stops talking, and immediately the color washed out of his face, and he went into like a full-on seizure. I tell people that it looked like a cartoon. His face just went from like colored to like white. Got my friends in there. We actually started doing compressions because he was not breathing. Then he started waking up, and I looked at my nurse friend and I said, what do I do? Obviously stop compressing him. He's waking back up. By that point, we probably had 15 people in the room probably trying to help get this guy the help he needed. He did end up going to the ICU for further evaluation, but that was a very memorable rapid response for me. That panic moment of like, what do I do? But that's why we have our nurse friends there and the support, the charge nurses and everybody we needed. And we got him the care that he needed and everything was good. So very memorable for me.
Codes can be really, really scary situations, even if you're not the primary nurse. But I can remember being a more seasoned nurse. And I think the easiest thing for me to do is to just get my hands in there and get involved. There's roles, there's somebody that's going to take control of that code. And so what was easiest for me to do in the beginning when I was still a little nervous is be the recorder, learn how to fill out that paperwork. And just getting comfortable with that made me feel more prepared to go into the next situation. I remember there was a code that went south. This was pretty early on in my career, and I remember just being terrified, not knowing what to do. It wasn't even my patient, but if they were calling for something that they needed, I was running and I was grabbing it. It scared me. That's the only thing I can say. I was really, really scared. It's one of those things that just keeps you up all night. You just keep thinking about it. That patient ultimately did pass away. I can't remember the circumstances of it, but I remember after that day, I told my supervisor that I wanted to get ACLS certified because I didn't want to feel scared anymore. And just the act of going through those classes and recognizing what else I can do. I'm sure all of us here have done compressions at one time or another, but it is not easy. It is not easy to give compressions. So I wanted to know, is there another way I can get involved? And taking that ACLS class really taught me a lot about what all goes into a code. And so even if I'm just the recorder, even if I'm just a runner, I felt a lot better and I felt a lot more confident in those codes after getting ACLS certified.
And you know, Laura, even though I'm no longer at the bedside, ACLS and mock drills are one of my favorites. Whenever we would put together a scenario, I'd be like volunteering. Even though I'm leading the team, I'd be like, let me take that because I wanted to put together what is important, what is out there, what I've seen. It's so important to simulate them, to see baseline information first. And of course, how we can improve on all of these processes, because it's true. That's how you can increase your confidence. So I like when you said that, Laura, be involved with these classes, be involved with the mock drills, recognize what your needs are and what training you need to be able to really be confident, because I think it comes with confidence as well. So just wanted to share that.
We kind of said in the last episode about be kind to your CNAs, personal care techs. And if I'm working with one particular, like I always try to, hey, are you going to nursing school? Like, what's your goal here? I always tell them doing compressions is never wrong. Another important part is being willing to do anything in that code. I remember I was charged that day. Hey, we need the charge nurse down here. I'm like, oh God, you know, who has a complaint about something? And this guy had just had, I think it was like a foot debridement, and he was feeling young and ambitious and wanted to get to the bedside commode to try to move his bowels. And somehow the tube going in there got detached. And I mean, he was bleeding out of that foot I'm not Shaquille O'Neal, but have pretty decent sized hands. And I'm wrapping my hand, like trying to squeeze his heel. And we couldn't stop him from bleeding. And me and this other guy just yanked him up off the bedside commode, got him in bed because he started turning pale and diaphoretic. He didn't fully on code. We didn't have to do compressions or anything, but it wasn't nice having to take a guy half naked off the bedside commode and toss him in the bed. He almost was like dead weight. And you just never know where someone's going to code. So a nurse was sharing with me that she had some students from another college and somebody vagaled down in the toilet. So the nurse, a couple of the students and their instructor had to take the person off the commode. And I think they did CPR on the floor for a minute or something like that. It's like, you just never know what you're going to have to do in a code. Expect the unexpected.
I like what you said about doing compressions is never wrong if you don't have a pulse, Neil. The first time as an educator that I had to do mock drills, it was because our T team was noticing that there were nurses on the Med-Surg floor that were appropriately calling an RRT or calling a code, but they were basically just waiting around for the team to get there. So we really had to show them how to put the pads on the patient. I mean, you know how to do this. You learn it in BLS, but in that moment, they were like frozen in fear and they didn't quite know what to do. So we had to go through just those early stages. You know how to check a pulse. You know how to check if the patient's okay. You know how to check if they're breathing. You know how to put those pads on, how to turn on the AED, put the defibrillator in AED mode, and do your BLS. And you do that until the rapid response team comes.
I like when you said they're frozen and they don't know what to do. I'm not sure if you recall, I shared this previously. I was mentoring someone and this person called me. She said, I have a patient who is coding right now. And I said, why are you calling me? Where are you at this time? And she said that she's in the med room and she was hiding in the med room. And I said, I'm so sorry that you're experiencing this, but you have to go out there. You have to go out. You can hear probably my frustration. And I kind of apologized with her because I'm like, you have to go there. And she started crying. And I'm like, oh my goodness, it's hard, especially if it's their first time seeing it or they had a traumatic experience. I share with you, when my mom passed away, I didn't go to the unit for 3 months. I just can't. It's so traumatic. And so if it's their first time seeing it or they had a previous experience, I can't blame them for being that. But I think if you know that you had that experience, you need to get ready, anticipate, practice, check on what your next steps are. Because in a unit, it will happen. It will happen unexpectedly, and you need to be ready.
I had a nurse that I had precepted and I felt so bad. It was his first shift off of orientation and his patient had been fine the whole day. They walked to the bathroom together, moderate to high falls risk. He was within arm's reach and the patient dropped the urinal. And so he turned his back for a second to pick it up off the floor. And that's exactly when the patient fagled and fell in the bathroom. He did the right thing and he yelled for help. He pulled the call bell and we all went in. But after that, it was hard to kind of get him back into a rhythm after that because he was so scared after that. And I would just have to keep telling him, you didn't do anything wrong. You did exactly what you were supposed to. Some things are unpreventable, but not losing your confidence because of a bad outcome. The patient ended up being okay. We got him awake and back in bed and just needed some fluids and stuff, but it definitely really shook him up, especially being his first day off of orientation, having a fall with this patient.
You brought up a great point, Sydney, because another piece of all of this is that you have to debrief. You have to talk about it. Whether that outcome was good or whether that outcome was bad, you have to talk about it. You have to analyze it. You have to think about what actions did I take? Were they the right actions? What would I do differently next time? Would I recognize this before it happens next time? You're right. You absolutely cannot prevent every single emergency.
No, and absolutely. I'll tag on to that experience that I shared a while ago. And I spoke to my mentee and I asked the question, what were you afraid of? And she can't even answer the reasons. When I broke it down to, was it your skills? Was it because you think you did something wrong? And that was exactly what she felt. Maybe the patient coded because I did something wrong. That's the hardest, I think, because we're too hard on ourselves as nurses, period. All of us, we are so hard on ourselves. We wanted everything to be perfect, but then it affects us at the end of the day. I know it's easier said than done, but we criticize ourselves, but you're doing the best that you can. You are enough. You are the best that you are, and you're doing your best in every single time that you do anything. So you are enough. You have the best intentions at all times.
What I do love about ACLS class is it kind of gives you, and someone else had mentioned, almost that predictive pattern of behavior of, well, this is what's going to happen. This is how it works. Your 2 epis, this, boom, boom.
Yes, it tells you exactly what to do.
Yes, those are the good algorithms to always have memorized. This is what we do, boom, boom, boom. So it doesn't seem as chaotic. That's where there's comfort in that algorithm as opposed to daily on the floor where it becomes just kind of mundane. It's a comfort in that algorithm of ACLS.
Exactly. It made me way more confident. It made me feel like I could handle it. I was a part of a team and I was more than just a runner. It made me feel better.
Yeah, because you know what's probably going to happen. And I think, Maritess, you were just saying about Sydney, about that newer person, that code, like Maritess, you said, like, you are enough. I think nurses as a whole, if the outcome doesn't come out the way you think it should, we'll sit there and evaluate and analyze and overthink. Did I call this soon enough? Was there a symptom I didn't see or a sign I didn't see sooner that I should have picked up on? I always say you can't fake diaphoretic. If I see someone just get diaphoretic without any kind of pickup on anything, I'm like, whoa, this ain't good. I've had 1 or 2 really, really hard codes, and probably one of them wasn't my first, but it was my last code. And he came back from toe IND, diabetic, relatively small medical history. And his wife just kind of said, he says he just doesn't feel right. And so for some reason, I went down that PE algorithm, and long story short, he actually had flash pulmonary hypertension. Didn't see it coming, didn't even think on that. We got him back, luckily. He went on to code a few times on the other floor, and I don't know long term, but even though we were successful, I was just like, why didn't you see that sooner? It was a hard code to deal with for quite some time. Very important to debrief.
Find someone you trust to talk about it, someone who has some experience in healthcare who can listen and understand what you're going through and just let you talk, let you get it out.
I definitely agree. Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we've learned. Rule number 1, don't panic and keep calm. Hit the button, get the rapid response going, and stay in that room to share all the details with the response team. Be sure you know how to escalate concerns within your hospital. If it hasn't reached a level of rapid response, begin with getting another set of eyes on the situation. Know your protocols, especially the things you can do before the rapid response team gets there. Trust your intuition. Don't be afraid to call that rapid response. Consider taking an ACLS class and get involved in mock drills to increase your confidence and preparation for those moments. Codes will happen. It's traumatic. We've all been there. You're not alone, and you will get through it. Debrief, talk about it, learn and grow from it. You cannot prevent every single emergency. To all our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag Med-Surg Moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Maritess,
Neo,
Sam,
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.